Hi, I'm Katie Lawrence, a veterinary physiotherapist and lecturer from the UK, and I wanted to provide a short lecture presentation on a progressive approach to rehabilitation with exercise. I'll be visiting Poland in May of this year, 2024, where I'll be holding a 3-day workshop with Rehab Vet. So I wanted just to provide you a taster of the subject and an overview of the importance of a progressive approach to rehabilitation. Okay, so first of all, let's have a look at why we need exercise rehabilitation in the first place. Let's have a think about how it can fit into a multimodal approach, how it can fit into your practice, your everyday practice. So if we just have a look at this cycle here, the easiest way to talk about this subject is to think of a general osteoarthritic case. But of course, during our 3-day workshop, we will be covering orthopedic cases and neurological cases as well. Just thinking about your general case that's lost mobility and that's suffering with generalized osteoarthritis. When we think of where we can bring in exercise rehabilitation, why it's so important, I find it helpful to look at this cycle. So if we imagine we have degradation here at the top. So as soon as we start to have any degradation, now this can be of a joint, of a tendon, of a ligament. Once we get degradation and we start to get an underlying pathology developing, we will get an increase in pain, an increase in inflammation, and a decrease in movement. We will also see a decrease in range of movement, a decrease in strength, and a decrease in proprioception. That goes on to cause a decrease in joint stability and also then a decrease in function. And this downward cycle, degradation, an increase in pain and inflammation, a reduction in generalized movement, a reduction in range of movement, strength and proprioception, joint stability and function, is a cycle that is self-perpetuating, and this is something that we want with exercise rehabilitation to break this cycle. So let's have a look at how we can do that. What we like to see then, what we would like to see is a decrease in pain, a decrease in inflammation. We would like to see an increase in generalized movement and also then an increase in range of movement, strength, proprioception, joint stability and function. That's what we would like to see. So how do we do that and how do we break this cycle? Well, first of all, if we have that degradation, we need to manage the pain. Obviously, this may be managed by the vet with pain medications, but also as a therapist, you will interject at this point by using your manual therapies and your electrophysical agents. At that point, we want to dampen down the pain so that we can reduce the inflammation and increase the generalized movement. Now, if you don't do anything at all at this stage, just by using your manual therapies and your electrophysical agents such as laser or ultrasound, you will be increasing the generalized movement. The animal will feel better and will therefore generally move around a little bit more. But if we can then interject with exercise rehabilitation, this is where we really have where we can really make some strides with improving the situation. So if we come in here with exercise rehabilitation, we have the pain and the inflammation modulated. We're going to use exercise rehabilitation now to increase range of movement, to increase strength, and to improve proprioception, to aid, to reduce the chance of re-injury. This also improves joint stability. When we have joint stability improved, we have a better function of the joint. So if our joint is unstable, then we have a situation where the joint is moving too much. We need to use strength of the muscles, increased neuromotor control, increased strength around the joint to provide more stability for that joint and therefore better function. And this then breaks that downward cycle, of degradation. And this is how we break the cycle. So that's just an overview for you as to why exercise rehabilitation is so important. So I want to just have a generalised think about progression of exercises. This is only a very short talk, so I just wanted to take a bird's eye view or an overview of the subject for you so that you can see where we will be coming from with the workshop and how we will develop through the different days, how we will develop systems and programs and ways to take your cases, your orthopaedic, neurological, or your mobility cases through this staged progressive approach. This is the framework that we use at the Animal Rehabilitation and Health Academy. And I just find this a very useful way to teach students how to progress their way through the exercises, and also to demonstrate how important it is that these areas are tackled in the right order. So our evaluate quadrant is where we must always reevaluate all the way through the exercise rehabilitation program. So we evaluate initially, we make an assessment of the animal and how strong, how stable the animal is. We also assess how much movement, natural movement that we have, and what that natural movement and gait patterns look like. But we also, which is why it's important that these are not linear quadrants, we move between these as we develop the program. It's important that at every opportunity we come back to this evaluate quadrant and we assess as we go along. So we cannot have one program for every condition that will be the same for every dog or every cat. It has to be tailored to the animal. And we start with a guide of a program, but as we progress through that rehabilitation program, we must be reevaluating every step of the way so that we can adjust the exercises to be perfectly appropriate for that particular animal. So then our first stage, and this is really one of the most important, or the most important stage, is our engage quadrant. And this is where we want to stabilize. So as discussed previously, if we have a lack of stability around a joint, which we very often have because when we have joint pain or we have any lameness or dysfunction, the muscles around that joint or in that limb start to switch off and we get muscle atrophy and lack of neuromotor control or disturbed neuromotor control. And arthrogenic atrophy is very common. With the loss of that muscle mass and that muscle control, we start to have very unstable joints. And unstable joints lead to further degradation, as previously discussed. So the first thing that we must do, and this stands true for mobility cases, for orthopedic cases, for neurological cases, the initial thing that we must do is stabilize. So we need to work here on core engagement, postural stability. We need to rebalance the muscles where we have muscles that are out of balance. We have some muscles that are overdeveloped, some muscles that are atrophied. We need to recruit the muscle fibers. We need to stimulate neuromotor control so that we can recruit more of those fibers. And this is the foundation for any rehabilitation plan. Before you can build on top of these exercises, you must have a stable foundation. So if we start to develop strength and powerful movements before the stability of the animal is corrected, before we have good stability, good core control, and good neuromuscular control, if we start to develop power and strength on top of that, we're going to create more injury. And we're also going to develop unwanted muscle patterns. Once we've got a firm foundation, we can then move on to mobilizing that. So if the animal can't do an activity when it's standing, it's not going to be able to do that activity when it's moving. So we must do the stability stuff first, and once we've done that, we can move on to mobilizing the animal. And in this quadrant, we're going to activate. We're going to start to look at more control of the movement. So if we want to do a particular movement, we can do that when the animal's standing, but then we want to activate, we want to move, and we want to control. Once we have that activation and that control within the movement, we can start then developing more and more power, skill, and strength. So we must work our way through this quadrant, and the progression of the exercises must follow a similar pattern to this to avoid re-injury and to have the best chance of success. Just looking at quickly the feedback loop and why this is so important that we start with these stability exercises, why the foundation must be developed before we move on. I'd like to just have a quick look at the feedback loop. Now, when an animal moves, in anticipation of that movement, nanoseconds before the movement occurs, there will be recruitment of the postural and stability muscles. So before you move, you can try this yourself. Before you stand up off your chair, before you lift your head up off your bed, you will feel your postural, if you tune into this, you will feel your postural muscles kick in. You will feel your postural muscles stabilize your joints because that's their job. And so this is called the feed forward response. So we have this a preparation for movement. Then we have a movement occur. During that movement, we have certain things happen, and this information is fed back to the brain. And this information informs the brain of what the feed forward response should be next time. Now, this feed forward response in animals that have reason to be having rehabilitation, so any animals that have injury or have had a neurological impairment, this feed forward response is normally altered and it's normally inadequate. So what we are going to do with our exercise rehabilitation is deliberately feed back specific information to the brain to promote this feed forward response being appropriate to stabilize the animal. And we're going to keep feeding in this information. If we don't interject, then the information that is fed back to the brain is not very useful, and it means that this feed forward response remains incorrect or possibly gets worse. So the information that we will be feeding back to the brain is through visual information. So this would be some of our proprioceptive work. We'll be providing a visual input from what we can get the animal to see, to walk over, to move around. We're also going to work on the vestibular input. So this is the balance receptors. We'll be working on balance and instability movements to promote awareness of balance and a vestibular input. And we will also be providing input through the musculoskeletal system, through the Golgi tendon organ, through the muscle spindle, and through other mechanoreceptors. We're going to feed back through sensory input to the skin and mechanoreceptors around the joint. All of this information that we have the ability to manipulate, we will manipulate this information, feed it back to the brain, and that is the job of an exercise rehabilitation therapist, to improve this feedback, feed-forward response, this feedback loop. Just looking a little bit deeper then, just to see how this works with neuromotor control, we are providing the proprioceptive feedback, we're providing the sensory feedback, and then we're also providing a learned and trained behaviour. So in this area, it's where we correct the behaviour. It's where we teach the animal exercises, where they have good form, good posture, and we teach them how to move, again once their movement and gait pattern has been disturbed. We retrain that and we provide that feedback. This goes to the CNS for processing, and what comes out of that is muscle contraction, when muscles should contract, which muscles should contract, and also the timing of muscle fibre recruitment. So using our slow twitch, our endurance fibres first, and moving up to our fast twitch fibres. This is encouraging postural stability. So, postural stability. So one of the first ways that we work with exercises is by providing postural stability. And we are going to challenge the dog's balance. We're going to challenge the recruitment of the muscles around their limbs, and we're going to gradually build that up. We are on balance discs, but we start on hard ground and we work our way to more and more challenging exercises. Sorry, I realise this is a bit fuzzy, this picture, but we then work on core strength and balance. So as part of our stability quadrant, we will be working on postural stability around the joints, but we're also working on core strength. So the strength within the abdominal muscles, within the apaxial and hypaxial muscles of the spine. And we're going to work very hard on engaging the core and developing that core strength. We're also going to work on balance. So again, this is where we feed through the vestibular system. Once we have that well established, we can challenge joint range of movement and proprioception further. So we have a simple set of cavalettis here, but there are lots of other ways we can work with this. This is just an example of one exercise that does two things. And so this would encourage joint range of movement and would also encourage proprioceptive feedback. And finally, we can then work on strength. So we, all the way through this program, all the way through our programs, we'll be working on recruiting muscle fibers. We will be working on neuromotor control, correct firing of muscles, so that when that's established and everything is in the right order, we can then layer on the strength. And this is when we start doing more hill work. This is when we start doing more harder targeted work, such as steps, dancing, hills, weighted exercises possibly, and also, anything like that will develop strength. This is where we also start to look at power and skill if we're working with animals that are doing some form of competition or competitive work. So I hope you've enjoyed that short overview. As I say, I will be holding a 3-day workshop, and this will be in Poland, and I will be with Rehab Vet, myself and my colleague, Julie. Julie is an experienced veterinary physiotherapist also. We will be spending 3 days in Poland from the 17th to the 19th of May, where we will be working through using progressive rehabilitation plans for orthopaedic and neurological cases. And I hope you can join us there. If you're interested in coming, then if you contact Rehab Vet for your place. I hope to see you there. Many thanks.